Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, the intersection of movement and aging. Dr. Jen Schrack, director of the Johns Hopkins Center on Aging and Health, talks to Stephanie Desmon about the work she and her colleagues are doing to explore the connection between physical activity, rest, and dementia. And the mantra we should all have as we get older is keep moving. Let's listen. Jen Schrack, welcome to Public Health on Call.
Thank you for having me.
I am so happy you're here today because I am fascinated by the work that you're doing. And so you are doing work sort of at the intersection of movement and health and really the effects it has on aging. So I'm wondering if you could just give a little overview of what we need to know about movement and health as we age.
So we slow down as we get older. I think everybody knows that. But one of the really fascinating facts about that is it crosses species. So it's not just people. Anyone who's ever had a dog, that as it gets older, it's slower and slower. It takes longer and longer to walk it. But it's also true of fish. It's true of worms. It's true of mice. This is a cross-species phenomenon, meaning everybody slows down as they get older, everyone and everything. And it's not just about choices that we make in terms of being active or being sedentary. It is a matter of physiology.
Tell me more.
So as we get older, it takes more energy to do activities, to do almost everything. So when we're young, we tend to walk at a given speed because that is what is comfortable for us. So if you think about walking down the block, if you started running as fast as you could, eventually you would get tired. And when you get tired, you would either slow down or stop. And so it's the same thing with walking as we get older. That same speed we used to be able to maintain comfortably becomes harder and harder. And there's different reasons for this. But one of the main reasons is it just takes more energy because our bodies become less efficient as we get older. And as we become less efficient, we need more energy. You can think about it like gas in a car or miles per gallon. Something that's less efficient takes more gas. So a person who is less efficient in terms of their energy needs, in terms of how they use energy, how their body regulates energy, is going to need more energy to do everything. And one of those big things is walking and moving as we get older.
Mm-hmm. So why is this important beyond being able to walk fast?
So that's a good question. Why is this important? Because it's important to understand how the body slows down, why it slows down, so we can understand how to prevent it. You can't prevent it forever. I've had people who work in other fields like cardiology and other fields say, well, if I walk faster, does that mean I can live forever? And I actually gave a talk about that once. Yes, it does help predict when you are going to die. There are a lot of studies that show slow walking speed, or what we call gait speed, is related to disability. It's related to frailty. It's related to death. It is predictive of all of these things, but it's really this marker of how your body is faring. So if we can keep you walking faster, we know that your body is capable of doing that, and therefore probably has less disease and disability associated with your health. So if we can keep that going, that's a good sign. But if we see that speed is declining, it could be a sign of a lot of underlying problems, both physical and cognitive, that are happening.
Mm-hmm. I was going to ask you the relationship between movement and cognition, cognitive decline. Talk to me about what you've learned there.
So this is a relatively recent addition to the field of gerontology, is understanding the brain and the body and how they're connected in terms of movement and health. So we've often known or thought that physical activity is a way to prevent cognitive decline, although I don't I don't know that we have a lot of hard evidence there, but certainly being physically active is good for us. And, that's good for our cardiovascular health, which is good for our brain. The same thing is now being looked at in terms of mobility in the brain. So how people move, how often they move, how fast they move, whether they move a lot at night, meaning they're not sleeping well, and how that relates to brain health. And there are some studies that show when people start to slow down or have movement difficulties, that can signal underlying pathology in the brain. So things like beta amyloid, that is predictive of Alzheimer's disease. We can see that when people slow down, they walk slower, they have abnormalities in terms of their pathology. And so that is very interesting because it could mean that the way people move may be an earlier predictor of cognitive decline and dementia than a traditional cognitive test.
So you do a lot of your work, you use wearable technology, is that right? I had a Fitbit until it died, and now I'm in analysis paralysis trying to figure out what to get next. But
Right. So, yeah, I mean, if you think about a Fitbit or an Apple Watch or even a Garmin, these are what we call consumer devices, meaning you can go to a store and you can buy it, or you can order it from Amazon and you can wear it, and it'll tell you about how much you move per day. And it packages it into these nice little tidy buckets of things like steps, or it tries to estimate how many calories you expend. And I think in general, for someone who's interested in monitoring their health, how much they move, or perhaps more importantly, how much they don't move, how much they sit, I think it is a good tool. But for research, we like to use things that are less restricted in terms of we can get to the raw data, which is really what we think of as acceleration, or how much people move, and in all different kinds of environments and in all different types of settings. So not just steps or calories. We want to know about all movement. And so we use different types of what we call research grade devices to try to understand movement at a deeper level.
And what do these devices tell you?
So in their rawest form, they give us what we call gravitational acceleration. So if you can think back to high school physics, if you ever talked about acceleration and you had to push a toy car and watch how long it would go till it would slow down, it's kind of the same theory. It's how much someone moves. We put it on a person's wrist, so it's like a watch, because generally that's the most comfortable for people. And we ask them to wear it 24 hours a day and to not take it off unless they have to. And they usually wear it for about a week and then they mail it back to us. And we've done this in thousands of people across multiple studies here at Hopkins and at other institutions. And what we've learned is there's a lot of information we can get from this in terms of when people start their day. So when you get up and start moving, when do you peak in terms of your activity? Do you do most of your activity in the morning or the afternoon? How broken up, or what we call fragmented, is your activity throughout the day? How often do you move before you stop to rest? We're also very interested in looking at stability of activity patterns. So day over day, do you tend to have the same pattern? Or how variable is it? Do you have a lot of variability around your activity? That could be good because it could mean you're a really active person and you do a lot of different things, so there's a lot of variability. Or it could be bad if you don't move a lot, but every so often there's a spike in activity that could be consistent with something like agitation or wandering that's often associated with cognitive problems.
Mm-hmm. So what are you looking for in these devices, and what is it telling you?
So we're looking for, it's taken a while to understand what we think is normal because we don't really know. If you think about these devices, in the scheme of things, they seem like they've been around a long time, but really in the sphere of science, they haven't been around that long. I would say over the last 10 to 15 years is when they've really become prominent. And it takes a long time to understand what we call normative data. So what's normal? What can we expect? And the National Health and Nutrition Examinations Survey, so NHANES, which is a big population level study, has put these what we call accelerometers, these wearables, on people to understand movement, but they didn't do much with older adults. So NHANES doesn't do a lot with people over the age of 60, and certainly over the ages of 70 and 80, there's even less data there. So one thing I've been trying to do is really get as much information as we can on older adults and how much they move. So we know what is normal for a 60-year-old, a 70-year-old, an 80-year-old, a 90-year-old. And that's really hard because there's a lot of what we call heterogeneity or differences in how people age, because it really depends on how you live your life. What are your behaviors, how much your access to care, things like that. How healthy has your life been throughout adulthood can really influence what happens to you as you get older. So it's really hard to understand what's normal for older adults, but that's what we're trying to do. And so we've collected data in over 10,000 older adults, and we're just starting to combine this data across studies and look at it to understand things like, for example, frailty. When do we know someone's on the edge of becoming frail? Well, there are certain things a doctor looks for, but it might be easier to just look at someone's data from their wearable and try to understand, do they have different patterns of activity, right? Are they more active in the morning or the afternoon? Or we're even seeing, are people more active overnight? So when we think about measuring sleep, one of the most popular ways to do that is to put a wrist-worn device on someone and see how much they move around during the day, but also at night, because the absence of movement at night is actually thought of as better quality sleep. So we're looking at this data now, and we see that older adults who are considered frail move quite a bit more overnight. Now, does that mean they're up and down? Does that mean they're tossing and turning? Does it mean their sleep is more restless? We don't really know that yet, but that is one very interesting finding. They also tend to start their day later. We also see that with people with cognitive problems, mild cognitive impairment or dementia, they tend to start their day later. So they don't get up as early as others. It takes them longer to get up and get going. Then we see that their activity drops off in the afternoon, and sometimes it comes back up at night because they're more active overnight. Again, is this something like sundowning for someone with cognitive problems? Is it agitation? We're not really sure yet, but we're looking into that.
Mm-hmm. And I imagine you're looking for ways to prevent this cognitive decline and this physical decline. Is that the goal here?
Exactly. We're looking for ways there's a couple things we're looking for. One is for earlier detection. So like I said earlier, if we see changes in someone's daily habits or patterns of movement, what we call rest activity rhythms, that could be a sign of underlying changes in their brain or their biology, their health, their disease pathology. And we're hoping that we can understand what is a clinically meaningful change. And so with that, it's what's going on under the skin, and can we detect it sooner than someone would at their doctor's office, right? A doctor with a routine test might not detect something that a device that's with you 24 hours a day, 7 days a week can pick up on. So that's one goal. So always earlier in the pathological process, earlier in the disease process is one. The other thing is thinking about access. It's often difficult for older adults, especially those with disabilities or mobility challenges, to get to their physician. And they can do things like telehealth, but the doctor doesn't see them move. And that's even true if people come into the clinic. Often our geriatricians say, the patient's already sitting there when the doctor comes into the exam room. So they haven't seen their patient move. But if we can somehow start to incorporate data from these wearable devices into clinical practice, that could be a world of information for physicians about how mobile people are. And that's extremely important to understanding their health.
Mm-hmm. And I'm guessing your advice for younger people, middle-aged people is just keep moving.
Keep moving. That is one of the biggest pieces of advice. And it's really interesting because we all know we're supposed to eat right and exercise, but for some reason, it's really difficult for a lot of people to do. But I think it's important to understand we're not just talking about exercise here. Physical activity is all movement above resting. So if you're sitting in your chair listening to this podcast, when you're done and you get up and you leave the room and you start walking or moving, that counts as physical activity, right? So every little bit counts. It's not just how many calories did I burn by going for a walk. That's volitional exercise, and that's important too. But if that's not achievable, I don't want people to be intimidated by this idea of, the guidelines are 30 minutes a day of moderate to vigorous activity. That's difficult for some people to understand and achieve. every little bit of movement counts. So the more you can move, the better. We know it's better for your cardiovascular health. We know it's better for your metabolic health, for maintaining weight, and we know it's better for your brain. And so keeping moving is one of the biggest obstacles for people. But if you can do it, even if it's just a little bit, it will help you.
Jen Schrack, this is really interesting, and I look forward to having you back to tell us more. Thanks so much for joining me.
Yeah, thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.